Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. The goal of this podcast is to optimize your health. To achieve this goal, I'm going to discuss the most common medical concerns that I find in my practice. The objective is to take the top 5 medical issues that my patients complain of, and I will create a podcast for each one of them, providing just a little more information during their office visit. The series is intended to supplement a regular office visit for my patients or for any listeners, and to get a little bit more insight into their medical health. Hey, this is going to be in the comfort of your own home or car. Without further ado, I will begin the show. Hi, this is Dr. Jonathan Youssef, and this is Networking for Your Optimal Health. Today's topic is going to be about diabetes. I want to make this quick and simple because I know my patients don't have that much time, so let's talk about diabetes. Really, diabetes is high blood sugar in your bloodstream. The causes are numerous, and we are not sure that we know all of them, but we do believe that there is a genetic component to it. Of course, obesity is one of the leading causes of diabetes, so being overweight and our American diet is definitely contributing. So what I want to talk about is your diet. I think at this point, for diabetics in particular, I want a low-calorie diet. While I still think low carbohydrates are very important in this particular case, I don't want my patients to go into ketosis because ketosis can be dangerous for patients with diabetes. So it can cause something called ketoacidosis. What I really want to do is just cut out those carbs. Anything that you eat, unfortunately, can turn into sugar in some way or another. So keep that in mind. Nothing is sacred here in terms of diabetes. So what I really want to do is focus on exercise a little bit more, which I do really think helps. But I will say that the diet is more important when it comes to weight loss as well as when it comes to diabetes. But what I want to focus on in terms of diet is a little bit more of that low carbohydrate, low, of course, sweets. And what I mean is breads, rice, pastas, and of course those little simple sweets, those sugars, those candies, those fruit juices. And so I want to keep, and soda, of course. So stay away from those. And what I really want to do is focus on exercise with martial arts because that's something that I like to do. But I do like a mixture of weight training and cardiovascular exercise. I do have a list of medications that I can provide. What I really want to do is just get those sugars down. There is a great deal of discussion about different ways in which we can reduce our blood sugars through different methods, including medications. And there is the brain activity, which can increase some hormones in your bloodstream. That's one way of attacking it. We can work on the liver and the pancreas. We can work on the end organs, meaning the muscles and the heart, to help them pick up more of the blood sugar so that it can be utilized correctly. I have a great deal I can discuss with you in the office, and unfortunately, diabetes is a very complicated situation. So thinking about a low-calorie diet or an 1,800 calorie diet is one way of looking at it, but I really would like to focus on a low carbohydrates and increase your lean meats, fruits, and vegetables, and of course, cutting out those certain types of fruits. I want to throw out just a few little uncomfortable topics regarding certain fruits like bananas, which is beloved by many. Unfortunately, has a great deal of sugar in it, and you might be surprised what it could do to your body. So, with that in mind, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Thank you for joining us.